The University of Tennessee Health Science Center has established a new initiative to help discover more effective treatment for diseases. It is called the BIG Initiative. That's BIG, which stands for Biorepository and Integrative Genomics. These are big words that refer to a collection of DNA samples donated by patients in the Memphis area to help our doctors study how our genes influence what diseases we get and how we will respond to treatment.
We're involving local area hospitals in the BIG project, and Regional One Health is now joining the efforts. As a patient of Regional One, you or your child has an opportunity to join the BIG team to create a brighter and healthier future and make sure everyone in our community is represented. Here's how it works. While a patient here at Regional One Health, providers will likely draw some blood for tests. Although we draw only the blood we need, sometimes there's a little left over. Usually the leftover blood is thrown away, but we're asking you for permission to save it so that it can be used by our researchers striving to develop new treatments and cures for adult and pediatric diseases.
Just to be extra clear, we will not ask to draw extra blood. We will only use the blood already drawn as part of your care. You or they don't have to do anything or provide anything extra. Samples donated to BIG will be studied by researchers at Regional One Health, the University of Tennessee Health Science Center, and scientists they work with at other research institutions.
One of the ways the samples will be studied is through a collaborative partnership we have with a commercial company that does our research to create new drugs to fight disease. They will analyze all of BIG samples using a process called whole exome sequencing that helps us learn about the makeup of the genes in your DNA. This will create genetic information that will be shared by all the scientists in this collaborative effort for use in future research studies.
Please know that the information we get from the blood samples and the samples themselves will never be sold to anyone. If you agree to participate, we will freeze the samples and store it in a locked containment facility on our campus for analysis. Information from your medical record will also be securely accessed to aid in this research. Any information from the samples that could directly identify you or your child will be removed and replaced with a code number. You or your child's name will never show up in the sample database, and the master list linking the code number back to you or your child's record will be kept in a separate, secure location from the samples themselves. We are doing everything possible to make sure this is a safe process that protects you or your child and you or their identity.
This research is covered by a certificate of confidentiality from the National Institutes of Health, meaning that even a court order cannot force us to reveal any information from this project. There's also a law that protects you or your child against misuse of this information. We will create a link between each patient's medical record and the DNA sample to allow researchers to better understand how genes directly affect people's health.
For instance, if we wanted to study the DNA of patients with asthma or sickle cell disease, we would need the ability to pull only those samples belonging to patients with asthma or sickle cell disease. Having a link to the medical record makes the samples even more useful. No one will be able to link the DNA to you or your child. No genealogy tests, cloning, or anything like that.
Participation in the BIG project and permission to allow us to collect leftover blood is completely voluntary. If you decide not to participate, Regional One Health will simply discard any unused portions of blood as we always have. In fact, if you give consent today but change your mind later, you could contact us about removing you or your child from the project. Your and your child's sample will continue with the study already being worked on by scientists, but if you change your mind, we can remove your and your child's sample from the future studies.
You will not be paid for participating in this study, nor receive any financial benefit from commercial products such as drugs or medical tests that might result in the future from research that uses your sample and information.
BIG hopes to improve how we treat patients in a big way.
And participation from patients at Regional One Health could make that happen.
We want all people from all backgrounds to be represented.
Participation in this safe, secure process may help improve the care of people just like you or your child by using leftover blood that would otherwise be thrown away. We are committed to keeping you and your child and your and their personal information safe. Samples will be used to help doctors learn about diseases and improve the ways they treat people now and in the future.
If you have any questions, please call us at 901-545-8699 or email us at big-roh@uthsc.edu, and we'll get back to you as soon as possible. You can also ask your nurse to contact our research assistants to speak to you if you want to learn more about BIG. Thank you for your time and for considering helping us improve the future of healthcare for all of our patients.